Hello all, my name is Janet Sartain. I am a senior nursing student in the Indiana State University's LPN to BSN completion program. These educational videos are being produced this semester in lieu of face-to-face clinical education because of the COVID pandemic. So this week, we're going to be talking about how to keep those kids safe. We're going to go over some prevention tips and treatments for accidental poisonings. After this presentation, the viewer should be able to identify the most common sources of poisons in the home, select safe storage spaces for dangerous products in and around the home. They should be able to give examples of simple first aid treatment for suspected poisonings and be able to use the poison control number to report any suspected poisonings. Every day in the United States, more than 300 children are classified as 0 to 19 years old. But more than 300 are treated in an emergency room as a result of an accidental poisoning. Unfortunately, of those 300, 2 of those will die, and that's pretty staggering statistics. So we're going to have a pretest just to determine how much you already know about accidental poisoning and first aid. So if you want to stop your computer right here, I'm just going to go on through, but if you'll stop your computer and just test yourself. So we're going to go over the most common sources of poisoning in and around the home. Medications, obviously. Medications tend to look like candy. Kids are curious. They want candy. They're going to eat it. Cleaning supplies, soaps, bleaches, that sort of thing. Gasoline, liquid nicotine, bad stuff. Pesticides, antifreeze. I've been told that antifreeze has a very sweet taste. I've never actually tasted it myself, but if it does, then one taste is going to entice a child to try a little more. Various houseplants and berries can be dangerous to children and pets as well. Laundry detergent pods and the dishwasher pods, for whatever reason, apparently those look like candy and children enjoy eating those. One of the last things that people don't think about are the little disc-shaped batteries. So how are we going to keep the kids safe? Tell me what to do. Some prevention tips that I can give you is to make sure that you have safety latches on all of your cabinets and drawers. Make sure it's the kind that lock when the cabinet and drawer close, or it locks automatically when the cabinet closes. Children can learn to work these things, but it slows them down a little bit. Make sure you discard any unused or old medications. A call to your local pharmacy should be able to tell you how to safely discard any of those medicines that you don't use anymore. Know your plants. Be aware of the type of plants you have in and around your house. Research them a little bit. Make sure that they're not poisonous for children or for pets. And if they are, get them out of the house. Cleaning products, you're going to want to keep everything up on a shelf way out of the reach of the children. Sometimes it's better if you can keep it out of view of the children, because if they don't see it, they're not going to want to go grab it and eat it. E-cigarettes and nicotine. It can take just a minute amount of liquid nicotine to be fatal to a child. Make sure it stays locked up and out of reach for children, or you can just stop vaping, but that's another video for another day. I'm going to preface this next section by saying that any of these suggestions should not be used instead of seeking medical treatment. You should always call 911, poison control, or get medical treatment immediately for any accidental poisonings. So first aid. For things like a swallowed poisoning, you're going to want to take the poison away from the child, have your child spit out what was in their mouth. Do not make the child vomit or use syrup of ipecac. For a battery that they might have swallowed or stuck up their nose or in their ear, go on to the emergency room. That's the best thing to do. If their breathing is impaired, call 911. They've been exposed to anything like acid splashed on their skin, gasoline, anything that's going to cause burning, or like the liquid nicotine that can soak through their skin. Take off all their clothes and rinse them in lukewarm water for at least 15 minutes. Something gets in their eye, you're going to want to flush the child's eye with room temperature water into the corner of the eye for at least 15 minutes. And for any kind of poisonous fumes, carbon dioxide, carbon monoxide, you're going to want to get the child away from the fumes. So take them outside into fresh air. If they happen to not be breathing, go ahead and start CPR. Rule of thumb, once you start CPR, don't stop until the child's breathing or someone else takes over. Poison Control's number is 1-800-222-1222. You call Poison Control, it's very non-judgmental. They're going to ask you questions. Some of the information that they're probably going to ask you will be the exact age of the child's exact weight, the exact name of the product, and it is okay to read it from the package. Spell it if you have to. Any symptoms exhibited by the child, if, for example, unconsciousness, blue lips, wheezing, blisters on the skin. Strength of the product, you can just read that off the bottle, milligrams, milliliters. The amount of poison that the child was exposed to. Don't guess if you don't know, just tell them that they were exposed. When it happened and how long the child was exposed. The size of the container, for example, the number of the pills or the ounces that it contains. A health history of the child, including any medical conditions they have, asthma, any allergies or current medications. And your relationship to the child, your name, phone number, and zip code. So let's revisit that test. True or false, a poison may get into the body through ingestion or swallowing, breathing it in, touch, or injection, like an insect sting. The answer to that is true. Swallowing a small button battery is not considered an emergency, and the child should be allowed to pass it normally. That's false. Swallowing a button is an emergency. It can cause the esophagus to erode, and the child should go to the ER within 3 hours. It's appropriate for medication to refer to medication as candy to convince a child to take it. Absolutely false. If you think your child's been poisoned, you've already taken away the substance, you've identified it, and you're sure there's not anything else in the child's mouth, what should you do next? Do not induce vomiting. Don't wait to see if they're going to develop any symptoms. Go ahead and call the family doctor. Don't call the family doctor, call the poison control line.
1-800-222-1222. 1-800-222-1222. If you think it might be poison.